Okay, hello, I'm Satoshi Matsuoka. I'm the director of RIKEN RCCS. And today I'm going to talk about Fugaku, which is the fastest supercomputer in the world, and of course, the fastest ARM supercomputer in the world. But in particular, what we're using, how we utilize the machine to fight against what's looming above our head, the COVID-19 problem, and some of the solutions we have, and hopefully to save the world. And so before we start, a little bit of coverage of Fugaku. A lot of people already know this, but just give you a very short synopsis. So Fugaku is Mount Fuji. It's the first exascale, so-called exascale machines, and was developed with the application's first philosophy in mind for what we in Japan call the SC'20 5.0. And Fugaku is another name for Mount Fuji, and basically signifies our idealism towards supercomputing that not only has very high peak, but also has very wide base, and base in terms of applicability, capacity, broad sets of applications, and broad user base, not just restricted to a few elites. And the fact that it's an ARM-based machine actually allows us to meet these goals. But of course, development of Fugaku wasn't very easy. In fact, the new chip ARM chip we developed, the A64FX, which is in the heart of Fugaku. Basically, there are 159,000 of them inside the machine. But each of the processor is 3 times faster compared to some of the top CPUs, general purpose CPUs out there. And it's at the same time being 3 times more power efficient. And it's general purpose. It's an ARM processor after all. So, it runs your smartphone app. It can run Windows. It can run PowerPoint and so forth. So to satisfy these high performance, low power, and also being general purpose, being the SVE extension in the ARM architecture was a huge challenge. And so it was a high-risk moonshot project that involved the entire Japanese HPC community, and that was the only way we could achieve this target goal. It was similar to like landing a man on the moon, but we achieved it. And as a result, we have the machine now, and the total capacity of this supercomputer is equivalent to about 20 million smartphones, which is about the number of smartphones, ARM smartphones shipped in Japan annually. More about 300,000 servers. So the back of the envelope calculation would be if we had 2 or 3 Fugakus, it would basically cover the entire IT needs of Japan throughout the year. So that's the magnitude of the machine that we have built. So in benchmark, of course, the machine was developed to excel in real applications. Not only Fugaku scored #1 for the first time in all 4 categories, but also we became several times faster than the #2 machines in the world out there. So this was very important, of course, because Fugaku basically would be doing this if we had met a goal that we would be fast and very broad sets of applications. Then it's obvious we'll be fast in all the benchmarks. And also several times faster compared to these pre-machines, faster, they were not Fugaku as being an exascale machine. So, we achieved both, and we're very happy about the technological achievements. And of course, this was made possible, the generality especially was achieved principally because it's an ARM-based machine. Now, but what is the machine useful for? Well, so like I said, the global problem right now, the biggest global problem we have right now is the COVID-19 pandemic. And even despite the fact Fugaku was not supposed to be deployed until April 21. Now, we had most of the machine on the floor by April. So it was only natural that some of the pre-production cycles will be allocated to COVID-19 mitigation programs. Of course, the long story as to how this program was set up very quickly in matters of weeks. But by and large, this was set up, and there are currently 5 teams that are combating COVID-19, and we'll have more. We're still soliciting, and also we have joined this U.S.-led fight against COVID-19 using HPC. But right now there are 5, and if you categorize these 5, 3 of them are basically dealing with COVID-19 as they are at the molecular level. That is to say, these are intended to study the behavior of the viruses and also search for various cures, such as drugs and also vaccines. But the other 2 are studying the virus in more and their transmissions in a more epidemiological and societal form, such as how droplets would be dispersed and how they would transmit amongst people, or even at a broader perspective amongst society. So let's say if we had this contact tracing applications, what would be how effective would be to mitigate the spread of the virus. So I only have time to cover 2 of them. So I'll just give you 1 from each category. So one is being led by Professor Dr. Okuno. And what he's doing is trying to find out how existing drugs can be repurposed in order to combat the COVID-19. The problem is, the good part of using repurposing these drugs is the fact that for many of them, we know their side effects. So the clinical studies could be quite short. And also, some of them can be very cheap and have very little side effects, and thus become one of the key ingredients for combating COVID-19, rather than to discover new drugs. So here is but what they're doing is to run these very detailed simulations. So on a previous supercomputer K, we could only run a handful of these because this is a very accurate molecular dynamics. And these are very, very expensive to run. So usually people use more approximate methods, but then they're not very accurate. So to do real discovery, you need to run these first principles molecular dynamics, which is accurate but expensive, and we need to run these thousands of cases. But with the power of Fugaku, we can do this. And here you see this one of the drug targets on the virus, protease, and the yellow part is a target, and we are administering a drug, niclosamide, which is actually a parasite drug that's administered to a lot of children in Africa since the 1950s. So we know the drugs, we know the drug very well. We know that it has very little side effect, and it can be very cheap to produce. And you can see that it binds the pocket. The pocket's a moving target, and but it's very known to be very effective. So the qualitative assessment of this is we have like I said, we have more than 2,000 drugs. So we score them, we rank them by their effectiveness, and we find that most of the drugs, of course, are not very effective. But we find a few or several that are very effective, and niclosamide is one of them, very, very effective. And there are some, and this is actually subject to a clinical trial already, but we are providing scientific evidence that this is actually very effective. So here you see the plot of the 2,000 or so drug candidates, existing drugs, repurposed drugs, as to their effectiveness. And you see that most of the drugs are not very useful, but there are several that are effective. And one of them is niclosamide that I showed you. And this is already under clinical studies, but we're providing very strong scientific evidence that this would be effective, not just being empirically effective. And also you find that there are some that are very effective, but not under clinical trial in any country. So we can actually have some countries or some group of pharmaceuticals actually try to provide evidence. And the computing requirement here is would have taken more than a year on a previous supercomputer, but on Fugaku, this is a matter of days, just a few days to compute for one drug target. So we're further, doing this further, doing some other target studies, and also collaborating with our experimental arm to see their effectiveness in vitro and in lab tests. And hopefully we can come up with these drugs, which could be also not only act as a cure, but as a preventive measure to prevent people from getting these diseases, and hopefully supplement vaccines and when administered to high-risk patients. So the other is the aerosol or droplet, and a lot of people worried when they go on commuter trains or when they're in taxis or when they're at concert halls or movie theaters and so forth, restaurants and so forth, that they may get infected. So, so we're doing very detailed studies with the high-resolution CFD and with multiphysics, led by Professor Dr. Tsubokura, to actually try to simulate these environments in very fine detail, and also to see what are the mitigation measures. So, so it's a very difficult simulation. You know, it's not very easy. Just to give you the scope of the simulation, there are various sizes of droplets, and beyond a certain size, they're called droplets, but if they're really small, they be turned into aerosols, and they float in the air for a long time. So droplets immediately drop on the floor and on the table, so they can be mopped up. But aerosols stay in the air for a long time, and they still contain viruses and could be subject to transmission. So in fact, one of the fear is we don't know how these transmissions are occurring, and there are a lot of unfounded contempt or ungrounded, scientifically ungrounded, hearsays flowing around that. So it's our mission to basically try to visualize these so that people will have a very good understanding of how things are and figure out, and we can, we give recommendations, and the government, actually the government and the industry uptakes these recommendations in a way such that they can give very accurate recommendations, and also people understand how things are occurring. And we're working with many industry partners, from transportation to air conditioning to food and Satori, like food and liquor, and also various government agencies in order to disseminate these results. So you can see that initially people thought masks were not very effective, but it turns out that of course depends a lot on the fabric material. I find actually the masks are very effective in containing the aerosols and the droplets. A lot of these droplets actually are contained by the masks. And of course, the non-woven masks that you find in stores are the most effective. And we have various numerical data to back that up. And also, but we also find the face shields on one hand are not very effective in containing the micro droplets or aerosols. They're very effective in containing large droplets, which contain a lot of viruses, but they're not very effective in containing the aerosols. So you can contain them, but you have to have very good ventilation to get rid of the aerosols in your room, or you might risk the chance of getting these aerosol infection. But they're still effective. It's a lot better than not wearing them at all, which is very well visualized in this animation. So this is using face guards one is to protect you from infected person. So affected person coughs, but you see that a lot of the big droplets are actually blocked by the face shield. The inverse, suppressing when someone's infected is even more effective. Even if he coughs, you see that most of the droplets actually just drops on his clothing. In fact, in this case, even the aerosols are well contained. So, wearing masks, even face shields, everyone wearing these protective devices, we find to be very effective in containing the viruses. And there are a lot of effects of humidity. When you have very dry air, the droplets quickly turn to aerosols. We can simulate that. And you see that here, compared to 90% humidity, you don't see as many droplets dropping, but you see much more aerosols blasting onto the person opposite to you. So so this shows that the way you protect yourself from the others depends a lot on the environment. For low humidity environment, ventilation of the room becomes more important, whereas for high humidity, sanitization of the desks or the tables and so forth becomes more important protective measure. And we can extend this, since this is simulation, we can extend this to very large environments where experiments are not possible. This is the theater. We can have a very accurate rendition of how the air flows in this very, very large auditoriums and theaters. And then using that, we can actually predict what happens when somebody coughs, because there's a flow there. When somebody coughs, with unprotected person coughs, you see the humongous amount of both droplets and aerosols kind of being emitted and carried, they are carried over by the AC, and so the people ahead of you are very well infected. Could be infected, whereas if a person wears a mask, this effect is significantly localized. Maybe we some effect in somebody sitting next to you or somebody just ahead of you, but it's very well contained. So we're working with companies like Centauri and Topon, and to invent new ways of protection. So coming up with the optimized configurations of face shields, we find that this oval-shaped, cup-shaped shields are much more effective compared to more traditional mouth guard and face shield shapes geometry, and we are verifying that in experiments. So the face shields actually, these flat face shields are not very good, but these cup-shaped or more complex-shaped face shield mouth guards or mouth face shields can be much more effective. So with Topon and Centauri, they're creating this new type of face shield, which can be used in dining and drinking environment and other environments, like when you have, let's say, spectator sports or in parties and so forth, where you can be very lightly protected. And I don't know if you can see me, but I have the prototype right here. You probably see my photo wearing it. It's very unobtrusive. Also, it can be opened up very readily, like that, to eat and drink and then close instantly. Very, very easy. And it's much less obtrusive compared to masks or other or shields. So so we're helping them to design this, and Centauri is doing very field tests to see whether how it can be improved. In fact, we're making the entire design open source, so people can pick this up, manufacture them, or even improve them, just like open source software, so that these kinds of protective measures can be made widely available to the public quickly. But of course, aerosols, these face shields or masks are not the only way to protect. In fact, it has to be combined with other preventive measures, especially aerosols, because we find that even with protective masks, if you see the animation, if you look at the bottom here, around your throat, you'll see, irrespective of wearing a mask or no mask, you see some accumulation of the aerosols. And so we find that these aerosols do penetrate very deeply. These microparticles penetrate well deeply into your lungs, deep down your throat and onto your lungs. So protecting, the only way to get rid of them is to have very good room ventilation. So we're studying ventilation in various settings like classrooms, so we can K-12s and universities can be opened up, and they will be readily with these students and children will be very much at low risk of infection, while we have cold months and hot months where you think ventilation will be very difficult. But we find that with various minimum openings, if they're done effectively, like diagonal opening of a small opening of the opening window and door, we find that actually they're very effective. All these, we have tons of results like that, and we're trying to make sure this gets well communicated. And so we've been staging multiple press conferences of our results, drug design, ventilation, droplets, and have been very effective. So as soon as we did these press conferences, the TV, the hundreds of the 100 press come and all the TV stations cover this, and they're immediately on every news channel in Japan. So if you ask any Japanese now, have you seen the Fugaku simulation on droplets, say? They said, and I can bet you that everybody will say yes. And if you ask them, have them useful? Oh yes, yeah. We now understand how we may get transmission. We understand how we may get mitigated, how it can be mitigated. Like, don't speak to anybody next to you, sitting next to you at a dinner table without proper protection. So it's been very effective in raising public awareness, and we like to think that one of the reasons why the infections numbers have been fairly low in Japan, despite the fact the country's pretty much opened up. In fact, the government's even encouraging travel, not just limiting travel. We're not locked down. In fact, the government's subsidizing us to travel, do leisure travel. That the infection numbers have stayed fairly low and stagnant. So, these types of science done on these big machines, and it's only possible in these big machines. Like I said, even in our previous machine, which was #1 in 2011, would take more than a year or several years to arrive at these results. Thanks to Fugaku, we can arrive at these results in a matter of days and weeks, allowing us to effectively communicate these results. And the public appreciates this. And I'd like to mention that one of the reasons why we can quickly arrive at these results is the ease of programming of these applications. Whereas if we had any type of very special type of hardware, we may have the results very quickly, but to program them would have taken years, again, which would not have been effective. So, so with that, I'd like to conclude my talk, and hopefully this has been useful, and ARM is being very useful in other ways in this very large computing